right, guys. So Dr. Aaron Gum here, founder of Blueprint to Practice Automation, yourautomatedpractice.com. I want to talk to you about this in this video about our spinal vitality programs with decompression and chiropractic. With Blueprint to Practice Automation, we have a bunch of niches. We have 12 niches and stuff like neuropathy and knee pain, plantar fasciitis, thyroid, autoimmune, leaky gut, keto, weight loss, knee pain. But we also have chiropractic and decompression. Obviously, the majority of our clients are chiropractors. We have a lot. We do have DOs and MDs, podiatrists and PTs and so forth. But for the doctors that are chiropractic doctors, we look at the current chiropractic and decompression models. We're not reinventing the wheel in this aspect with practice automation. We are just replicating the doctor's time, the things that they repeat themselves, maybe the doctor's report, the seminar, the group report of findings, the online patient education. So we're not really telling you how to practice in chiropractic. There's a lot of different types of techniques. You got upper cervical, you got Pedibond, you got corrective care, you got diversified and Gonstead, whatever it may be. We're not really centering our program around a technique. We are centering it around things that you can use in your current process to help you replicate yourself, buy yourself time back, buy yourself energy back, putting your patients into a process that's automated, keep them engaged online with education on wellness tips and chiropractic tips and stretching and exercises they could be doing at home. So that being said, our decompression and chiropractic programs, we're not giving you exact protocols. We'll give you suggestions for like decompression, but there's a lot of different types of decompression programs out there as well. We're not centering the education around any type of technology. We're centering it around the concept of what the spine does in decompression. We call it disc rehydration therapy. It has a different ring to it. A lot of people haven't heard about it. So it can fit in any type of program, any type of clinic. What's what I'm getting at. Our processes can fit in any type of program. So with decompression, pretty simple. We go into the training. We'll teach you what decompression is, some back conditions that it helps with. If you've never tried decompression before, you'll find our first two modules here and here helpful. Just an overview of what decompression is, the benefits of it for your clinic, and so forth. We're going to teach you some nutrition protocols that you can implement into your decompression program that's going to help with decreasing inflammation, helping increase nitric oxide, which obviously is crucial for healing in the healing process. We're going to teach you some equipment that you can offset your decompression programs with to send home with your patients. Infrared device and stimulation devices, and some of them you can implement inside your clinic to actually make decompression more comprehensive. So we have a really cool stimulation device that re-educates the whole lumbar chain from all the way from the feet all the way up to the lumbar back and back down the other leg. While you're doing decompression, this is going to give you better results, better clinical results. It adds value to the patient's process, their experience. And then obviously some of the equipment that you can send home with them to offset some of their healing at home. Give them something to work on at home. So they can do at home. So when they're done, they have some things that they can keep doing at home. We teach you how to set up programs, very simple things of how to set up different tiers of programs for decompression. Consult ROF. The most important part with this program, we have an automated seminar that you can use, put your patients through. So if you want to do a seminar format for decompression, we have a seminar you can use. We have an automated report of findings that you can use. Obviously, we have all the marketing that you want around any of our niches, really. We go out and find good vendors that work. We go out and find good people that will negotiate TV and radio for you. We'll go out and find good mailer companies that work very well for decompression. We have newspaper ads. We have radio scripts. And then the daily exercises. These are the daily exercises right here. These are the daily exercises that are going to be in the online curriculum. So once a decompression patient becomes a patient, we have a curriculum built out around recipes of the day, non-inflammatory recipes of the day, wellness tips of the day. So they're going to be learning above and beyond spinal care, why sugar causes inflammation, why sleep's important for healing, different things that you and I would probably, if we wanted to sit across the desk and tell our patients, We put this in a format that you enroll them into our software. It educates them along the way the entire time for 60 days. So it doesn't matter. It doesn't have to be exactly every day, but for 60 days, they're going to keep engaged. A couple of things that's going to happen. It's going to give them it's going to keep in front of your patients. It's going to help with your retention of your patients. And also it's going to add value to the program that you're offering them. So you can bump up your case fees because now you're offering more inside your program, not having to do any of the work. So you have the automated process that they can go through, seminar, consultation, education, or ROF. We teach you how to do that in your process. It fits in any type of process that has any type of clinic. It's very flexible with chiropractic and decompression. And then we have the online curriculum that keep your patients engaged. And that way, if your patients are engaged, they're going to show up to their visits. And if they show up to their visits, you're going to have better compliance and better clinical results, which you get better referrals at that point. So that's important. Also, wellness workshops. We have certain wellness workshops online for your patients to be able to watch on different topics outside of spinal health. It may be what gluten is, why weight loss is important, why exercise is important, just different things that we want to add value to their life outside of just spinal care. So when they walk away, they're like, man, I'm out of pain. I move a lot better. I'm back in the gym, but I learned about how to lose weight or what to eat properly, what a non-inflammatory diet is. I learned a lot of different wellness tips. So they can walk away knowing that they got their money's worth. Okay. You know, the old antiquated programs of just fee for service. So they come in, they get the adjustment, they get the decompression treatment, and it's worth this much. And then they go home, they don't hear from you. They got to make it, they have to be accountable for themselves to show up to the next visit. There's no reminders, nothing like that. You know, that in this day and age, people are getting so busy and distracted. We got to stay in front of our patients now, just not potential leads, but we got to stay in front of our current patients so they can show up and they can feel like they've got added value. So our decompression program, the automated video content and the online education, that can fit in any type of decompression protocol. So if you're doing decompression in laser, if you're doing decompression in this, there's a lot of them out there. I know all of them. It doesn't matter what you're doing, it fits in it. Okay, so if you want to replicate yourself and pre-educate your patients better, have through video in your office, and then keep in front of your patients through online curriculums, then it's going to be a good fit for you. If you don't care about those things, it may not be a good fit for you, but I can't imagine that you're not caring about that. So going back into, you get chiropractic. So we have chiropractic. So with the chiropractic program, very similar stuff. We teach you how to do the report of findings. So we have a group report of findings. It's about 39 minutes. So if you're doing group report of findings, you can use this 39-minute ROF video for your pre-education before you go over their x-rays when you separate them out into the consult ROF room. Or you can use the same video one-on-one, which a ton of our doctors do. We have over 350 doctors across the country. A lot of them use our chiropractic ROF video before they even meet with the patient. It's a prerequisite for them to be able to meet with a doctor. They have to go through the proper education. And that can be in a group setting. That can be in a one-on-one format, in a consultation room, on a TV or an iPad, or in the waiting area on the iPad. So they're required to go through that education. That's up to you. Or we have a short chiropractic report of findings, about 12 minutes long, that works really good in any type of process. You can do it before you walk in the consultation. You can do it before you go over the x-rays. You can do it both to remind them of what they learned. It doesn't matter. But you can use that short ROF video in any instance. So it really fits into any type of chiropractic process. So it's really cool. And the same thing with chiropractic. We have the online curriculum teaching them, very simple spinal exercises to be doing at home. There's video and picture descriptions for them to be able to use. And then there's also non-inflammatory diet recipes of the day. They got wellness tips of the day. They got seminars online to attend if they want. And it's adding value to your chiropractic program of care. Instead of them just showing up and you having to worry about educating your patients and staying in front of them, you have a system that works for you 24/7. It's the cheapest employee you'll ever find with our systems, okay? So when we look at the chiropractic and decompression programs, They're very, very flexible. So a lot of doctors ask me, well, is it going to fit in my practice? Well, it's made to fit in any practice. The biggest thing with chiropractic and decompression is just really being able to automate that pre-education process, the ROF process, and then online education to stay in front of your patients for retention. Because chiropractic and decompression, you're not going to get away from, 2 to 3 times a week visits for a period of time, because the spine needs consistent motion in it to rehab it and re-educate it back to its position. So we're not going to get away from the 2 to 3 times a week visits like we can with knee pain and neuropathy and plantar fasciitis, and how we can eliminate the visits for weight loss and eliminate the visits for functional medicine like gut health and thyroid and keto and autoimmune, those things. We can't eliminate the visits in decompression and chiropractic. Believe me, I've looked and multiple things there's no home unit that I bought like 6 of them that can replicate the beauty and the art of the hands laid on a patient to increase motion and life in the spine. You can't replicate that. Okay. So you can streamline your chiropractic and decompression processes. If you don't have decompression, this is a good way to start. And man, I think that's it. Again, we have over 350 doctors across the country. We're helping tons of patients, thousands a month across the country with different conditions. And also, we can learn how to implement your chiropractic and combine your chiropractic and decompression with our metabolic components. Every patient that walks through your door has a metabolic issue. And if you're not adding that metabolic component, and you're losing money and you're losing healing, you're leaving it on the table, so to speak. No pun intended. But if you are adding it already and you have all these chaotic systems in your office that you have to keep up with to manage those metabolic systems, well, we've figured out, we've cracked the code on this. We've really created a software to track the patient properly online, to educate the patient properly online for the metabolic components, and to be able to track, keeping them accountable. They can even send virtual questions in if they have questions about that component. So not just we can streamline chiropractic and decompression pre-education process and post-education process, we can teach you how to combine niches through practice automation, adding extreme value, bumping up your case fees, collecting more money, and you're only servicing one of the niches in the office. All the rest is online. So it's really cool. So I hope that gives you a good overview of the chiropractic and decompression programs. It works in any office, and it's very flexible. It's not like our neuropathy and knee pain and plantar fasciitis is really strict. Those programs are really straightforward, and we have a very specific process that you have to follow to get the clinical results. But we've made this very flexible. So I hope that helps, guys. And again, Dr. Aaron Gum, founder of Blueprint to Practice Automation, yourautomatedpractice.com. To find more training about our systems, go to www.theautomationdoc.com. Again, www.theautomationdoc.com. God bless, guys. We'll talk to you soon.